What do my STI blood test results actually mean? Getting your blood test results for sexually transmitted infections can feel confusing, but understanding what they mean is important for your health. When you get tested for STIs using blood samples, the results usually fall into 3 categories: positive, negative, or inconclusive. Each tells a different story about your infection status. A positive result means the test found evidence of an infection or antibodies related to an STI in your blood. This indicates that you either currently have the infection or have been exposed to it in the past. For infections like HIV or syphilis, a positive screening test often requires a follow-up confirmatory test to verify the diagnosis. If your results are positive, your healthcare provider will discuss treatment options, further testing if needed, and steps to protect your sexual partners. Common STIs detected through blood tests include HIV, syphilis, herpes simplex virus types 1 and 2, hepatitis B, and hepatitis C. A negative result means no evidence of the infection or related antibodies was found in your blood at the time of testing. While this is reassuring, it does not always guarantee you are free of infection. Some infections have a window period, which is the time after exposure when the infection might not yet be detectable. For example, hepatitis B can take between 8 and 22 weeks to show up, hepatitis C from 2 to 26 weeks, and HIV up to 3 months. If you suspect recent exposure or develop symptoms later, retesting after the window period is recommended. Remember, negative results do not replace ongoing safe sex practices or regular testing if you are at risk. In some cases, your test results may be inconclusive or equivocal. This means the test was unclear or borderline. This can happen if the sample was insufficient, if the infection is very recent, or if your body is recovering from an infection. When this occurs, your healthcare provider will usually suggest repeating the test after some time or doing additional testing to clarify your status. The accuracy of blood tests depends on timing. Testing too soon after exposure can lead to false negatives, while false positives are rare but possible. Confirmatory tests help reduce these errors and provide more certainty. Some blood tests detect antibodies your body produces in response to infection, like HIV or syphilis tests. Others look for antigens, which are parts of the virus itself, such as hepatitis B surface antigen. For herpes, blood tests detect antibodies but cannot reliably tell if the infection is active or past, so interpretation can be more complex. Once you receive your results, your next steps depend on what they show. If positive, follow your healthcare provider's advice on treatment and notifying partners. If negative but recent exposure is suspected, retesting after the recommended window period is wise. If you are sexually active with multiple or new partners, regular testing is important since some STIs can be asymptomatic but still transmissible. Always practice safer sex methods to reduce your risk of future infections. In summary, your blood test results provide valuable information about whether there is evidence of an STI or past exposure. But they need to be interpreted carefully, considering timing, the specific test used, and your symptoms. Always consult with a healthcare professional who can guide you on what your results mean for your health, suggest any further testing, and help you plan the best course of action to stay safe and healthy.